Have you ever been told, at your age, the surgery is routine? Nothing to worry about? I have heard that sentence more times than I can count. And I've also seen what happens when that reassurance turns out to be incomplete. Because here's the uncomfortable truth. Some surgeries that are considered standard can carry very different risks once you're past 50, 60, or 70. Not always obvious risks, not always immediate, but subtle complications that can quietly change the course of your life. And today, I want to talk about 7 surgeries that, under certain conditions, can be far more dangerous for older adults than most people realize. You know, after decades in medicine, one thing becomes very clear. The body at 70 does not behave like the body at 30. Healing is slower. Reserves are lower. Small stressors become large ones. Now, before we go further, let me say this clearly. This is only from a physician's perspective, based on years of clinical observation and medical knowledge. It is not personal medical advice. Every individual situation is different, and you should always consult your own healthcare professional before making any decisions. If you find this kind of calm, experience-based explanation helpful, you might consider subscribing. Not for quick fixes, but for understanding your body in a deeper, more practical way. Now, let's talk about something I hear very often. I'm just getting older, so I probably need the surgery. That assumption is where many people take the wrong turn. Because yes, aging brings changes, but not every condition requires an invasive solution. And not every surgery improves quality of life the way we expect. In fact, some can do the opposite, especially if the underlying cause hasn't been fully understood. Let's begin with the first one. 1. Spinal fusion surgery. This is often recommended for chronic back pain, and on paper, it makes sense. Stabilize the spine, reduce pain. But here's the problem. In older adults, the spine is rarely the only issue. There are often multiple levels of degeneration. Reduced bone density, muscle weakness. So, when one segment is fused, the surrounding areas take on extra stress. And this is where most people make a mistake. They expect relief, but instead develop new pain above or below the fusion. Recovery is also long, and for many, mobility never fully returns to baseline. 2. Knee replacement surgery. Now, this one surprises people. Knee replacements can be very effective, but not always in older individuals with multiple health conditions. Healing requires strong muscles, good circulation, and active rehabilitation. Without those, stiffness and limited function are common. I've seen patients go in expecting to walk like before, and come out struggling more than they did pre-surgery. Also, the risk of blood clots, infections, and prolonged recovery increases significantly with age. 3. Carotid artery surgery. This procedure is done to prevent strokes by removing plaque in the neck arteries. It sounds logical. Prevent a stroke before it happens. But here's the nuance. In older adults, especially those without symptoms, the benefit is often smaller than expected. Meanwhile, the surgery itself carries a real risk of causing the very thing it aims to prevent, a stroke. Now, I am not saying it's never appropriate, but the balance between risk and benefit becomes much more delicate after 65 or 70. 4. Prostate surgery for benign enlargement. This is extremely common. Men are told, your prostate is enlarged. Let's fix it surgically. But many cases can be managed conservatively. And surgery, while often effective, can lead to complications such as incontinence or sexual dysfunction. What's more concerning, older adults may not tolerate anesthesia or post-operative stress as well. And sometimes the symptoms were manageable to begin with. Let's pause for a moment. Notice a pattern? It's not that these surgeries are bad. It's that the context matters. Age, overall health, functional reserve. These factors change everything. Now, let's continue. 5. Major abdominal surgery like colon resections. These are sometimes necessary, life-saving even. But when performed electively in older adults, the recovery can be extremely demanding. Digestive function slows, appetite decreases, and the risk of complications like infections or prolonged hospital stays rises sharply. I have seen patients lose significant independence after such procedures. Not because the surgery failed, but because recovery overwhelmed their system. 6. Shoulder surgery for chronic pain. This one is often underestimated. Rotator cuff repairs or joint surgeries are offered for persistent shoulder pain. But here's the reality. Many older adults adapt well to limited shoulder function without surgery. After surgery, however, there's often a long period of immobilization, and regaining strength can be difficult. And this is where expectations become important. Pain may improve, but function does not always return fully. 7. Heart bypass surgery, coronary artery bypass grafting. Now this is a serious one, and an important one. Heart bypass surgery can be life-saving in the right patient. But in older adults, especially those with multiple conditions, the risks increase significantly. We're talking about longer anesthesia times, higher risk of cognitive decline after surgery, sometimes temporary, sometimes not. And this is where many families are caught off guard. They expect the heart to be fixed. But don't anticipate the potential for confusion, memory changes, or prolonged weakness afterward. Recovery can take months, and in some cases, patients never return to their previous level of independence. Now, again, this does not mean it should be avoided in all cases, but the decision must be made very carefully, weighing quality of life, not just survival. Now, let's go a bit deeper, because the real issue isn't just the surgery itself. It's what I call the hidden stress load on the body. As we age, 3 things change significantly. First, physiological reserve. Your body has less margin for error. Second, inflammation response. Healing becomes less efficient, sometimes exaggerated. Third, resilience to setbacks. A small complication can lead to a cascade of problems. And this is why 2 people can undergo the same procedure and have completely different outcomes. So what should you do instead? Let me give you a simple framework. First, ask better questions. Not just, will this fix the problem? But, what happens if I don't do it? Second, evaluate function, not just symptoms. Are you still able to move, live, and enjoy daily life? Third, consider conservative options first. Physical therapy, medication adjustments, lifestyle changes. Fourth, and this is critical, assess your recovery capacity. Do you have the strength, support, and resilience needed after surgery? Because surgery is not the end of the journey, it's the beginning of recovery, and here's something many people don't hear often enough. Sometimes doing less leads to better outcomes. Not always, but often enough that it deserves serious consideration. I'm not here to tell you to avoid surgery at all costs. That would be irresponsible. But I am here to encourage a more thoughtful approach, to pause, to question, and to understand that routine does not mean risk free. Because at this stage of life, the goal shifts. It's no longer just about fixing problems, it's about preserving independence, maintaining quality of life, and avoiding unnecessary harm. And that requires a different kind of decision making. If this perspective gave you something to think about, you may want to subscribe and stay with this channel. We take the time to look beyond simple answers and focus on what truly matters as the body changes over time.